Hello, thank you for the opportunity to join you for the Riyadh Global Digital Health Summit. I'm very pleased to be able to talk to you about digital health and national policy responses to the pandemic. Firstly, my apologies for not joining you live. As you'll appreciate, it's currently the very early hours of the morning in Canberra, in Australia, where I'm based. Making health systems more focused on patients' needs rather than processes is a key theme of the long-term National Health Reform Plan being implemented by the Australian Government. Achieving this requires important shifts in our healthcare practices and our healthcare funding. Digital health, of course, has enormous potential to facilitate these shifts by offering the opportunity of taking healthcare to the individual rather than always expecting the individual to come to healthcare services. Digital health has been growing in Australia for more than a decade, but I think it's fair to say that compared to digitisation of other areas of the economy and society, progress has been slow to date. That's changed, of course, with the need to keep our people safe and to slow the spread of COVID-19. Digital health has now become essential to Australia's response to the pandemic, and at the same time the pandemic has given a huge boost to the use of and acceptance of digital health. Like many countries around the world, Australia had to react quickly as the potential magnitude of this threat from this complex virus became clear. The Australian Government worked with the medical professions, with state and territory governments, and with many other stakeholders to develop a national plan. On the 11th of March 2020, the Prime Minister, the Health Minister and the Chief Medical Officer of Australia announced the $2.4 billion plan to ensure that the nation's health system was well prepared and had the resources needed to fight coronavirus and protect the community. This was the result of intense negotiations and discussions between the national government, the state and territory governments, and leading medical experts and health and professional groups. The package is designed to ensure that the health system has the right tools, the right information and the right resources to keep Australians safe. One of the goals was to give the health system greater capacity to effectively assess, diagnose and treat people with COVID-19 in a way that minimised spread of the disease in the community. So while at the same time maintaining the capacity of the healthcare system to deal with other health issues, to avoid a decline in the population's underlying health status. Two things were essential. Firstly, securing adequate supplies of personal protective equipment to health professionals. And secondly, removing the need for people to travel to a doctor's clinic, to an emergency department and wait in rooms full of other patients and sit close to a doctor when they needed a diagnosis or a prescription. Telehealth offered the potential to deliver on this second requirement. Telehealth has long been recognised in the National Universal Health Funding Scheme of Australia, Medicare, as a valid way of providing health services. But Medicare subsidies prior to COVID-19 were limited to video consultations and primarily targeted to allow people in regional, rural and remote communities to access mental health and specialist care. In November last year, Medicare benefits were extended to regular telehealth consultations with GPs with their patients in remote areas. But with COVID-19 making non-contact medicine highly desirable, it was a logical leap and not such a great leap to turn to telehealth. In a highly pressurised environment, the government consulted with medical organisations to determine what would work best. And the result was that reforms which could have taken 10 years were delivered in 10 weeks. During the pandemic, telephone-only services, in addition to video consultations, have been allowed to ensure universal access. These were introduced as temporary measures due to expire in October, but it's possible they will be retained as a positive legacy from the pandemic. And discussions on this are being held with the medical sector, with consumers and with other experts. There's no doubt that telehealth has now been embraced by both healthcare providers and patients as a core part of our national policy. Since March, more than 22 million services have been delivered by telehealth to more than 9 million patients. On the other hand, any new system usually requires some bedding in. and the Australian Government continues to monitor the telehealth measures and make refinements as needed to ensure the safety, clinical effectiveness and continuity of care. For this reason, additional restrictions were brought into force on the 20th of July. Family doctors, GPs and other medical practitioners can now only provide a telehealth services where they have or their practice has an existing relationship with the patient. And this is designed to promote greater continuity of care, to build the relationship between provider and patient to support better long-term health outcomes. There are some exemptions which include people in areas currently impacted by COVID-19, those in quarantine, children under the age of 12 months, and patients of Aboriginal community-controlled health organisations. And further exemptions will be considered if necessary. The restrictions were designed in consultation with the major medical peaks to ensure that they were meeting the needs of patients and of the providers who are delivering health care to the public. And the impact is being closely monitored, with further exemptions again perhaps being made if they're necessary, with mental health being one area under review. But in the longer term, further improvements may be needed to support widespread use of telehealth in terms of further infrastructure, technology, education of the workforce and privacy. The other important digital health element in Australia's response to the pandemic to date has been the development and adoption of a mobile phone app called COVID Safe. Early identification of people exposed to the virus so they can be isolated and tested is essential to slowing the spread. The Australian Government Department of Health collaborated with the Digital Transformation Agency and other agencies to develop an app for Australia. COVID Safe uses Bluetooth technology on the mobile phone to look for other devices with the COVID Safe app installed. It takes note of contacts with other users, digital handshakes, by securing and logging their reference code. And these contacts are then stored on the phone for 21 days, which allows for the 14-day incubation period of the virus, plus the time taken in some cases to confirm a positive result. If a person tests positive for COVID-19, with their consent, contact information is uploaded, and state and territory officials can then quickly find other people who also have the app and who may have been exposed to the virus by contact with the person who's been diagnosed. Only users who've been within approximately 1.5 metres of the positive case for a period of 15 minutes or more are identified. The app has been designed with privacy and security as paramount considerations, and downloading and using it is voluntary. Overall, the COVID Safe app is doing what it is intended to do, identifying individuals who've been exposed to risk of COVID-19. None of our states or territories are relying 100% on the app to do the entire job of contact tracing, and in some jurisdictions, public health officials are very adept at finding contacts who've been exposed using other means. But the app has been used more than 300 times by health officials. To give one example, in a recent case where authorities in New South Wales accessed the COVID Safe app data, it showed a previously unknown date where exposure to the virus had occurred at a venue which had been known to have had cases on other dates. This resulted in the identification of an additional 544 contacts, and 2 of those people, when they presented for testing, were confirmed as having COVID-19. While these numbers are small, we've learned that every case of COVID-19 is important. A single person can have the potential to cause an outbreak, and from there, things can escalate very rapidly. The pandemic has disrupted many aspects of our lives, and millions of workers have had to work from home, utilising digital solutions to replace functions normally carried out face-to-face. Many of these workers and their employers would previously have considered out-of-office work either impossible or undesirable. But many workers and employers have continued remote work, at least part-time, even though the immediate health threat in their parts of the country has since lifted. And the same has been seen with digital health. The pandemic has caused a terrible toll, but in this regard, it has been a creative disruptor. It's quite possible that the huge increases in the use of digital health and acceptance of mobile phone apps for public health purposes will provide a lasting benefit. No response is perfect, and I don't pretend that everything has always gone to plan in Australia. We continue to learn about this virus as the pandemic progresses, and we will continue to apply those learnings and evidence as it evolves. As we all know, nothing about the pandemic is static. Thank you for the opportunity to be with you today, and thank you for the opportunity to present some of the findings from Australia.